And as the confinement in some country ends and citizens slowly resume their daily activities and return to work, there are concerns about the psychological effects of emerging from life during the lockdown. The struggle for a proper mental health is not just for the citizens, but also patients who have recovered, their relatives and health workers on the front line. Some agencies are now offering support services to make the transition easier. And public health physician Kadiri joins me now to discuss this. Good to have you join us, Maimuna. Now, tell us what you're beginning to find out as people are returned to work. A lot of countries are easing their lockdown. What are your observations in terms of mental health, whether for people who are getting back to work or healthcare workers?
Thank you very much for this opportunity. The thing is that for any medical condition worldwide, we have what we call the biopsychosocial model in managing any medical condition. The biological in this case is that you see a number of the rate of screening has increased, confirmed cases, and the social aspect of it is the relief fund that you are seeing government giving to individuals, to the citizens of the country, and of course individuals and well-meaning citizens of the country that and corporate organizations are also supporting. But the missing link is the psychological support, and we do not want that to go, not looked into, because people have gone to the isolation center, they've been treated, they've been discharged. We do understand the stigma attached to people living with, any form of a medical condition, especially when it comes to a global pandemic like this. Likewise, their family members, and we cannot rule out the fact that the frontline health workers managing them are also dealing with some emotional challenges. Hence the reason why our organization, Employees Assistance Professional Association of Nigeria, we brought about coming together to support these people so that they can, get this support and be reintegrated back into the society, properly heal better, and the pathway to recovery will be smoother. So this is the reason why we deployed this service.
So like you rightly said, people, there's anxiety everywhere, whether for people who are afraid that they are going to contract the virus, or for those who already contracted the virus, or for health workers who are contracting the virus. And like you also mentioned, there is a missing link, which is a psychological support. So what can be done by government at all levels to create that psychological support? And just generally, every one of us, what can we do to create that psychological support for people?
The best thing is for government can't do this alone. That's the truth. Government can work with already existing associations, the psychologists, the psychiatrists, counselors. It's good for government to identify this organization, work with them, and deploy this service so that everybody is doing something at their own end, in their own little corner, and able to help everybody. For us in the Association of Employees Assistance Professionals Association of Nigeria, what we have been able to do is to have 10 free lines. They are toll-free. That's the beauty about this. They are toll-free lines. The center is open 24/7, and we've been able to get our members as volunteers to mount these lines on a day-to-day basis. In fact, we even have a roster. So I'm one of the founding members and one of the members of the board of trustees, and we are working around the clock. We update ourselves on a weekly basis to know what has been happening, what we need to do better, how we need to liaise better, how we can co-opt more members to join this. So I believe if government also understand that there's an association existing like this, we can work hand in hand with the NCDC, the government presidential task force, and let everybody understand that this service is available. For example, those people that run away from the isolation center, if they are properly counseled and told that, look, we have a high rate of recovery, people will not run away. And people sneaking from one state to another state, infecting other people, they need proper education, sensitization, and counseling. And we believe that if this missing link is fixed, we will be able to achieve much more, and recovery will be better, and people will be well reintegrated back into the society.
All right, Maimuna, just before we let you go, I just want to find out, for the people you have spoken to on those toll-free lines, what has been their major concern and worry?
Anxiety, especially the healthcare workers, like the doctors and the nurses in the front line. They have loved ones who are worried about them. And I'm sure you must have heard in the news, one of the emergency ER doctors that was treating a COVID-19 patient actually killed herself. We do not want such in this country. And we do know that a lot of people are being affected. So anxiety, fear of the unknown, will I be infected? Will I infect my family members? And those that have been discharged, you know, that stigma, I don't want people to know that I was one of those that went to the isolation center. And that's why they are not bringing out names when they say 20 people have been discharged. So all that, they just need to just listen to somebody who wouldn't judge them, who wouldn't criticize them, who would tell them that all is well, you have recovered, you can go back to your normal life. So just generally alleviating their fears, their anxiety, and getting them back into their regular program.
Public health physician Maimuna Kadiri, many thanks for sharing your perspective with TVC News.